This is an iHuman patient's short tutorial on how to navigate the history. The most important thing that we should know about a diagnostic history is its purpose, and the real goal is to identify the cause of the patient's symptoms with the goal that we're going to treat the patient. We want to focus on characterizing each symptom, identifying risk factors, fill in the pertinent history to understand who the patient is, and the history note card that I'll show you inside the case player is key to help you keep track of all of that. Remember, this is not a generalized patient assessment history. We'll get to that in a different lecture. Also remember that although social determinants of health are absolutely critical, they usually become most critical once we've diagnosed the patient and we're trying to figure out the management and therapy of said patient. So let's get started. We're going to open the case player, and here is Marvin. He's got fatigue and cough. Let's start. I'm going to write that down. And then the next thing I'm going to do is mute him so I don't have to listen to his breathing, look at the observations, nothing there I need to look at. If I needed to get case instructions or go anywhere else, include closing the case, my hamburger menu's right there all the time to help me. The green banner tells me I'm in learning mode, so I'm going to get lots of feedback and education along the way. I am going to first look at his chart. Here I can see he's got a temperature. So the key findings is where I write down all the critical pieces of information that are not normal. Running around with a temperature like that is not normal, not life-threatening, but just not normal. I can look at all of his history through the management plan and notice he deferred his flu shot. So that might put him at risk for things. I would look through all of that carefully, but let's get to actually asking questions. I can press the microphone and speak. Why are you here? That's a pretty rude and abrupt question. And so my natural language processor is saying, well, do you really mean like, how can I help you today? If I select that, I get the good question above his head, meaning I have gotten the key point. The authors come up with the minimum number of questions needed, and I find out he has body aches and he's tired, so I've confirmed his fatigue. The next thing I can do is I can just type a question. Any other symptoms? And press return. And do you have any other symptoms or concerns? Yeah, adding concerns might be helpful. I get another good question above his head. I find out he's got a sore throat and a headache. And these are notes to myself, so I can abbreviate to whatever level I want. If I want to write additional notes to myself, notice up here in the upper right, I have a push pin and I can write notes to self. I can return to the case. That also is always available. Or I can use the file folder system. Now, whether or not this file folder system is available is the decision of your professors. But if they give it to you, let's say I wanted to ask about his cough, there's all sorts of questions on cough, and I might want to ask, when did it start? And again, good question, and it was yesterday, so I can add that. Notice of all the file folder system, I've got history of present illness, past medical history, I've got social history in lots of different areas, and then finally review systems. And if I look at that, I've got the big review systems question plus a whole bunch of other questions that have been compartmentalized in there. So that's to help expand your horizons on what types of questions are there. Notice this case has been set with a limit of 80 questions and that I've asked 3. So let me just randomly ask a handful more. And then let's say I wanted to see what have I asked before. I've asked about bleeding gums. It says previously asked. But if I want to put it in context, I can pop open the dialogue again if your professors have made it available to you and review the entire history. I can minimize it, move it off to the side, or collapse it back down and open it later. The other thing I can do is I can use the history note card to keep track of all of those notes. I can expand it out, and this will help me get all that detail, which is actually going to help me come up with my differential. So I would really strongly recommend you use it. When I finally think I'm completely done, I can pop open History Hints again if your professors have agreed to give you access. And you can have either no access, not available to as many as 10 hints. Again, your professor makes that decision. And it will tell you the general category that those questions reside. When I'm finished with everything, I might want to then do the exercises that might be involved, because I might learn a little bit more about whatever disease process he might have. And then when I'm completely done, I would move over to get clinical feedback. And again, in this particular case, the professor has decided to set it up in the old carts fashion. I might also have it set up where it just gives me a list of questions that I should have asked that I didn't. And you can see the orange is not asked but required versus the green, I did ask that. And this is again to get you into the use of a structured history. So hopefully with that little feedback, you will be a superstar at getting all of the history questions you need in order to diagnose this patient. Thank you for your attention.